Hi everyone, a quick crash course of the anterior triangle of the neck. This is visible on the lateral side of the neck where you have sternocleidomastoid. Anterior to it, you'll have the anterior triangle of the neck, and posterior to it, you'll have the posterior triangle of the neck. So the anterior triangle of the neck, it is bounded medially by the interior median plane of the neck. So if you look at it here, so this is the entire anterior triangle of the neck. This is sternocleidomastoid, right? So sternocleidomastoid, anterior to it, anterior triangle of the neck. So first of all, medially, you will see that there is anterior median plane of the neck. This is an imaginary line. Then, when you talk about laterally, it is bounded by sternocleidomastoid. So this is the sternocleidomastoid laterally, and superiorly, you'll notice it is bounded by an imaginary line which extends from where exactly? From the mastoid process to the angle of mandible and also the base of mandible. So angle of the mandible to the mastoid process. This is a mastoid process. You'll have an imaginary line. Also, one thing to remember, mastoid process is further away and styloid process is like inner, towards the inner side, right? This is the styloid process, sorry. Styloid process and mastoid process, and this is the ramus of the mandible, this is the angle, and then you'll have the body of the mandible. So there's an imaginary line which extends from the mastoid process to the angle of the mandible. This is the imaginary line, right? And also anteriorly, again, you'll have the imaginary line, which is anterior median plane of the neck. Then this imaginary line, and posteriorly, you'll have the, or laterally, you'll have the sternocleidomastoid muscle. So these are the divisions, or these are the borders. Now, so medially and laterally and superiorly, correct. Now, subdivisions, it is further divided into submental, digastric, carotid, and muscular triangle. And this division is done by the digastric muscle and the superior belly of the omohyoid. First, let's get this sorted that this is the omohyoid muscle right here. You can see it has a superior belly and it has an inferior belly. In the middle, it has an intermediate tendon which holds it to the clavicle and also the first rib by the fascial sling. So that's how it is divided into two parts, right? And then you have the digastric, anterior and posterior. Again, it is held in place by intermediate tendon which holds this muscle to hyoid by the fascial sling, right? Now, uh, this is the digastric posterior anterior, right? So this is one muscle and this is one muscle. These are very important muscles that should be on your mind, right? Now, when you talk about, I hope this video is getting recorded. Anyway, so I was saying when you talk about, okay, this, right, this is one muscle. Now, it's very important to know that these muscles, especially superior belly of the omohyoid and digastric, these are the ones that make all of the further divisions. So because of them, there'll be a certain number of triangles within this one triangle, right? So what are those triangles? You will have submental triangle, which is right here. You can see this is the submental triangle. You'll have a submandibular triangle right below the angle of the mandible, and here you'll also see the submandibular, the superficial part of the submandibular gland. So this is submandibular gland, also known as a triangle, also known as a submandibular triangle or digastric triangle. This is the submental triangle. This is the muscular triangle because it has all the muscles. Muscular triangle, and this is the most important carotid triangle, right? So these are four triangles that you should know. Also in this, you can see this is the digastric or submandibular, this is submental, and this is the most important carotid. And then you'll have a carotid, sorry, very important, and then you'll have the muscular here itself, right? And muscular basically has anterior wall as this imaginary anterior median plane, right? This is a very nice real life example. So this is your muscular, so this is the anterior median plane, this is the carotid, this is the submental. So it is divided in two parts, as in it basically extends both towards the lateral and medial aspect. So this is medial and this is laterally, it also goes. This is a triangle and this is submandibular digastric. I hope that's clear, right? And also this is the diagram. I think I'll just show this to you from every possible diagram so that it's clear to you. Submandibular digastric, this is submental, this is your muscular, and this is the carotid. That's clear. Okay, now we're done with this. Now no more division for this. Moving forward, we have submental triangle. This is a median triangle. Now you know it's a median triangle and how it sits. It is bounded on each side by the interior belly of the digastric muscle. So yes, anterior belly, and the base is formed by the body of hyoid bone, and its apex lies at the chin. Okay, so let's look at this. So basically, submental triangle we're talking about. So if you look at here, so its apex is at the chin. That's something we know. Base is by the hyoid muscle, and the lateral walls are by this is the interior belly of the digastric muscle. So I hope that's clear. So if you look at it from this aspect, you'll notice this is the hyoid bone, This is the anterior belly of the digastric muscle, and this is the chin. So these are its borders. Easy. Whenever you think about submental, just think about this. So anterior part of the digastric muscle, hyoid, and the chin. So these are the borders. Done. Also, they're saying that in the okay. So this is submental median triangle bounded interior on each side by the anterior belly of the digastric, based by the hyoid and apex chin. What about the floor of the triangle? Floor has right and left mylohyoid muscles and a median raphe uniting them. So the floor is the mylohyoid muscle, and in the middle you have the median raphe. For this, there's a better and clear picture. Where is it? Let me just have a look. This one right here. See, so digastric, hyoid, chin, and then this is the floor, mylohyoid, right? So see, this is the mylohyoid muscle, and deeper to that is hyoglossus. So mylohyoid, and this is median raphe. Done. This is the segmental triangle. Now I'm sure the entire picture of the floor and the borders is clear. That's it. There's just floor. There's no roof to it. Thank God. Contents. It has submental. Since this is submental, so it has submental lymph nodes. They're situated in the superficial fascia between the anterior bellies of the digastric muscle, and also it has small submental veins which join to form the anterior jugular vein. So just two contents, very easy. That's it. So submental lymph nodes and submental veins which join together to form anterior jugular vein. For this, I'll refer you to this diagram. See, this is the only diagram that should be in your mind, and you'll be clear with it. Submental lymph nodes and then submental veins which come together to form anterior jugular vein. So anterior jugular vein. See this anterior jugular vein, and you have submental vein as its branches, right? So we're done with the contents. Easy. Submental is the easiest, and we're done with it. Digastric. Digastric is right here. If you can see, this is the digastric. Remember, where is digastric? Right here. This is the digastric one, right? And also, this is the digastric. This is the contents. From there, you can see the floor and everything. And here, this is my favorite digastric, favorite picture of digastric. You can see superficial submandibular gland. Right. So boundaries. It is bounded. What do you think? Posterior-inferiorly, antero-inferiorly. So antero-inferiorly and postero-inferiorly. And then we have superiorly or base. So superiorly or its base is the base of mandible and a line joining. So this is the base. Base is the base of mandible. Also, you have the body of the mandible actually. Or is it base? Okay, base. Base of mandible, and also the imaginary line which was joining from the mastoid process to the angle of the mandible. That is also the base. That is also the superior border, the base, right? Angle of mandible to the mastoid process. That's one thing. Then it has posterior-inferiorly and antero-inferiorly. Antero-inferiorly, it has the interior border of the anterior part of the digastric muscle, and posterior-inferiorly, posterior part of the posterior belly of the digastric muscle. Easy. We're done with that. Now, yeah. Also, this is one image of the submental if you want to refer to it, and these are the digastric muscles. Right, now moving forward, if you talk about the roof has skin, superficial fascia, and superficial fascia has platysma. That's nothing different or nothing new, and platysma is innervated by the cervical branch of the facial nerve, which is the fifth branch of the facial nerve. And also you have the transverse cutaneous branch, transverse or anterior cutaneous nerve of the neck, right? Then deep fascia is there, which encloses the submandibular gland. Deep fascia also encloses the parotid gland. That's it. Now, floor. Floor is formed by the mylohyoid muscle here as well, and also hyoglossus muscle posteriorly, and a small chunk is also there of the middle constrictor muscle. So if you can see this right here, you'll have the mylohyoid muscle, right? This is mylohyoid. It will also have a little bit of hyoglossus muscle. That's what they're saying, right? Hyoglossus muscle. You'll also have hyoglossus muscle, and also there'll be the constrictor muscle of the pharynx, and which constrictor? Middle constrictor muscle, right? So here you can see there is a small chunk of middle constrictor muscle. There is hyoglossus, and this is mylohyoid, right? So this is the floor. So we're done with the floor. Whenever you think about the floor, that should come to your mind. Right, now moving forward, the contents. The contents are this. So there will be two ways the contents are divided. One is interior, one is posterior. Interior to the mylohyoid or superficial to the mylohyoid, and then posterior to it. Superficial to mylohyoid, you'll see submandibular salivary gland. And since this is superficial to mylohyoid gland, this will also have the mylohyoid. It is superficial to the mylohyoid muscle, so it will also have the mylohyoid nerve as well as the vessels. So mylohyoid nerve and vessels will also be there. Okay. So these are the uh, three things that we know by now: mylohyoid nerve and vessels, and the submandibular salivary gland. Then very important, you'll have the facial vein, and you have submandibular lymph nodes. So that's two things: submandibular lymph nodes. But there's one thing that the facial vein and submandibular lymph nodes, they are more of superficially. So this is facial vein and submandibular lymph nodes, superficially, and the facial artery is deep. So facial artery is there, facial vein is there, and submandibular lymph nodes are there. So submandibular lymph node, submandibular gland, that's there. Then you have the facial vein and facial artery. And facial vein and submandibular lymph nodes is superficial, and facial artery is deep, right? And you have the mylohyoid nerve, and you have the, that's it for now, right? And also, even though this is not a submental triangle, but it has the submental artery, right? So it has the submental artery. Now you may be wondering, what did the submental have? Submental didn't have anything, it just had the lymph nodes and anterior jugular vein, right? So the two arteries, veins are coming together, the submental veins were coming together to form anterior jugular vein, small submental veins. Here you'll have the submental vein also. Let's since submental, since what do you call it? The submental triangle is further, right? So that's why there you'll have the further division of anterior internal jugular vein, right? Anterior internal jugular vein, anterior jugular vein. Okay, now you'll also have hypoglossal nerve here. You'll have hypoglossal nerve here, and in the next one, the posterior part, you'll have the vagus nerve. You'll also have, do you have the vagus nerve? Yes, you have the pharyngeal branch of the vagus nerve, and you'll also have the glossopharyngeal nerve, right? So in the posterior part. Other than that, in the posterior part of the triangle, you will have superficial structures, which is the lower part of the parotid gland, and external carotid artery, because external carotid artery supplies the parotid gland. That's how you need to learn. And then you have the deep structures, styloglossus, stylopharynges, and yes, styloglossus and stylopharynges. And then you have the glossopharyngeal nerve and vagus nerve, and then you have the styloid process and part of the parotid gland. Parotid gland is also here. And I know you may be wondering, this is so confusing, but you need to learn it. The deepest part has very easy contents of the carotid sheath, which is internal jugular vein, internal carotid artery, and vagus nerve. So it has internal carotid artery, and actually, don't you think carotid sheath has common carotid artery? I think it has common carotid artery, right? Let me just have a look here. Carotid artery is there. They didn't mention if it's common or it's internal, but anyways. So you have internal carotid artery, internal jugular vein, and vagus nerve. Now moving forward to the carotid triangle. Carotid triangle is again very important. Where is the carotid triangle? What do you think? So let's look at that. And also here it's important for me to mention, is there any other diagram that we can refer to for all of these things? I don't think there's need. Okay, anyways, moving forward. Yeah, this was the diagram that you need to refer to for submandibular triangle. It can get a little tricky, but it's okay. Now we're talking about carotid triangle. This is the carotid triangle. So first of all, its boundaries: anterosuperiorly posterior belly of digastric and stylohyoid. So anterosuperiorly, it has posterior belly of, okay, sorry, this is not carotid, this is muscular. This is carotid. Anterosuperiorly, you will have the posterior belly of digastric, and with the digastric, you also have the stylohyoid muscle. This is the posterior belly of digastric, and in the front, you can see this is the stylohyoid muscle. This one right here, this is stylohyoid, and at the back, you can see that is posterior belly of the digastric. This one right here is the posterior belly of the digastric, right? Also here you can see that as the digastric is running, right with it is also stylohyoid muscle. So that's why uh, anterosuperiorly is the stylohyoid muscle, and the what do you call it? The posterior belly of the digastric. And anteroinferiorly, there's another muscle, which is it? It is this muscle right here. Let's discover what it is. Anteroinferiorly, superior belly of omohyoid. So you have the superior belly of omohyoid here, right? Superior belly of omohyoid. And posteriorly, you will have the sternocleidomastoid. Roof skin superficial fascia containing platysma, and platysma is innervated by the cervical branch of the facial nerve. Transverse cutaneous nerve of the neck, you have investing layer of deep cervical fascia. So not just superficial fascia, also deep cervical fascia, it's particularly investing layer. The floor is formed by middle, inferior constrictor muscles of pharynx and infrahyoid membrane. So you can see this is the middle constrictor muscle of the pharynx. This is the inferior constrictor muscle of the pharynx, and this is the thyroid muscle, but it's membrane. So this is the carotid triangle, right? Done. And these are the boundaries. You can see omohyoid is there, and this is sternocleidomastoid. Okay, moving forward, this is a floor. Contents would be everything related to carotid. So you have common carotid artery. It divides into internal, external in the carotid triangle itself, and then you have everything related to it: carotid sinus and carotid body, right? So you can see this entire thing would be there. This is the internal jugular vein, and you have the common carotid artery divides into external and internal jugular vein. So, and then you have internal and external carotid artery. You have the internal jugular vein as well. You also have common facial vein. Where's the common facial vein? Right here, you'll see this is the common facial vein right here. This is the common facial vein. It's not marked here, but here you can see this is the common facial vein right here. This is facial vein. This is the common facial vein. So you have common facial vein also in the carotid triangle. So that's one thing. And you have pharyngeal vein and lingual vein, right? And then vagus is running very dramatically and vertically downwards. You have the vagus nerve, and that you can already see from here that how the vagus nerve falls down. So you have common carotid artery, then you have vagus, and then you have the internal jugular. And common carotid is medially, right? So here in this diagram, you can see of the carotid sheath that how the common carotid is medially and it is running downwards. Vagus is between them, very dramatically down, vertically downwards, and then you'll have the internal jugular vein, right? So this is the entire thing: internal jugular, carotid, and vagus. And in the front of this carotid sheath, you'll have ansa cervicalis. This is ansa cervicalis, a loop of C1, C2, C3, which was supplying which muscles? Infrahyoid muscles, but particularly these three infrahyoid muscles, except the thyrohyoid. Now moving forward, yeah, so vagus nerve is also there, and then all the other contents of the carotid sheath, common carotid artery, and internal jugular vein, right? Now we have next thing is that vagus nerve, it has a branch, superior laryngeal branch, and then superior laryngeal branch divides into external and internal laryngeal branches. Both of them are here. You'll have spinal accessory nerve here, which is running backwards over the internal jugular vein. So if you look at internal jugular vein, this is internal jugular vein, and this is spinal accessory nerve, which runs backwards over the internal jugular vein. Right here, you'll see it will run over it and backwards. So you have internal jugular vein and hypoglossal sorry, and you'll have the spinal accessory nerve which runs backwards. You'll also have hypoglossal nerve here, and you'll have sympathetic chain which is right behind this entire uh, triad. Behind it will be the sympathetic chain, and then you have the carotid sheath with its contents. Lymph nodes are deep cervical lymph nodes, jugulo-digastric, and jugulo-omohyoid lymph nodes, right? Then muscular triangle. Muscular triangle, for that, I would refer you to this diagram. This is a very clear image. You can see that superiorly, anteriorly, and inferiorly. So anteriorly, you have the anterior median line of the neck from the hyoid bone to the sternum. So anterior median line from the hyoid bone to the sternum. This is anterior median line, which is imaginary line. Then posterior superiorly, you will have the superior belly of omohyoid. Posterior superiorly, you will have the superior belly of omohyoid, and posterior inferiorly, you will have the sternocleidomastoid muscle. That's it. Contents are infrahyoid muscles. What are the infrahyoid muscles? Infrahyoid muscles are responsible for what? First of all, these reside below the hyoid bone, and they are responsible for stabilizing the larynx and the jaw. Right, for stabilizing the larynx and the jaw. Therefore, what do? They depress the hyoid bone and larynx, right? So they depress the hyoid bone as well as the larynx. They stabilize the larynx and the jaw. So they depress both of them, larynx and the mandible or hyoid bone, sorry. So these are infrahyoid muscles. Sternothyroid, sternohyoid. So there's sterno up till thyroid, sterno up till the hyoid, then omohyoid, and then thyrohyoid. Right? This gets divided into two. Sort of, you can learn. That's the way you can learn. So infrahyoid muscles. So content of muscular triangle would be all the infrahyoid muscles, yeah. And yep, that's pretty much it.